Okay, Tariq, you know what's going to happen. What we will do is we'll start. Then you introduce Franco. You have the schedule in front of you?
Yeah. So is Franco here? Can I see him?
He should be joining. There, he was waiting in the. Just 1 second. I'll just get my schedule. I left my schedule in the room. Just 1 second.
Dr. Tariq, please unmute करिएगा अपने आप को.
जी. Okay.
जी sir.
Can you please email Nakib Achakzai and send him his things to do? He said he hasn't received that on his email, or maybe send him on his WhatsApp. Can somebody sort that out? Things he has to do.
Yes.
So is let's see. So Franco is in here, so we'll just unmute him. Get him in here as well.
Yeah, 1 second. Yeah, he's in mute.
Hello to everyone.
Hi, Professor Servadei. How are you?
Yeah,
Hi,
Franco.
Hi, Franco.
Franco, how are you, man?
I'm okay. Hello, everybody.
Hello.
So we should be ready to go in 5 minutes. We can unmute David Adelson as well, please.
1 second, sir. Yeah, he's unmute.
Good morning.
Hi, Jim. How are you? Early morning for you?
Sorry, David, to wake you up this early. I apologize for that. We just gave you half an hour extra to sleep.
I appreciate it. Thank you. It worked out well for me.
No, I'm sorry about that. Somehow we had to manage this to make sure that people so everybody's accommodated.
Gentissimo.
Okay, this is brilliant. Franco, you have your schedule in front of you?
Yes, my dear. It's here.
So brilliant. So if there is anything you want to change, we can change. There's no problem. It's not a formal conference. It's just to appreciate everybody who's out there.
Yeah, that's no problem for me. The only thing, as I told you, 4:30 sharp, I need to finish.
Yeah, no problem.
A university meeting where we have to vote. So, you know, when you have to vote, you have to be there.
Okay, fair enough. No problem. I think we will start sharp on time. We have 4 minutes to go. Imad, have you asked somebody to send details to Nakib Achakzai regarding what he has to do?
Yes, sir.
Please, thank you.
It's done. I'll WhatsApp him.
Okay, brilliant. So we will get some committee chairs, obviously the David as well, and a couple of people from Pakistan Society to honor these people. So what we'll do is we'll give them virtual certificates, and you will be, Franco, you'd be the kind host to give them these certificates. So it's just virtual, so they'll get it straight in their email. And we will show the certificate, obviously.
Well,
very good idea, Salman.
Okay. Listen, we can shorten my part. I can speak for 25 minutes or so, and then we can shorten the discussion. So we will have more time for the ceremony, as you like.
Sure. I think it depends on if you Tariq, you can decide. I am just the host here, one of the hosts.
So I have 25 minutes presentation or something.
Brilliant.
Something like.
Yeah, it's important because there are so many, there will be so many participants, trainees as well. So it's important that we teach them something at the same time. And they need to realize how important it is that these people have given up their time, an important time away from the family while they were either at home or they were working or whatever. They found time for us and taught all of them. So it's amazing. So we need to make sure that obviously we give them something back as well. Do we have all the people who are giving certificates in already? Imad, have you checked? Can you check, please?
Sir, most of them are in, and some of them are joining.
Professor Rez is here.
Yes.
Maybe you can unmute him as well, please.
He's unmute.
Miguel, how are you? Good afternoon.
Fine, thanks, dear Salman. Happy to be here joining this session. Thank you for everything and congratulations for all you have done. Wonderful.
Hello, Miguel.
Franco, all the best.
All the best through Pakistan. Spain and Italy through Pakistan. Nice.
Yeah, Franco, the funny thing was that, you know, we used to follow how the trend is of people attending. So every time you would have from, you know, although the timing is awful, but from South America and from North America in the area where it's 5:30 a.m., you know, there will be people connecting for these simple webinars that we were conducting. So it's amazing. 73 countries on average were connecting. So it is really an honor for us. I just started it for my residents, and then slowly it just, everybody wanted to do it. So, and all our friends wanted to do it. I just started it for. So, Tariq, whenever you're ready, I think we have 5:30.
Okay, hello everyone. Welcome to this webinar. And today, our speaker for the presidential address needs no introduction, Professor Franco Servadei, President of World Federation of Neurosurgical Societies. And I must say that a very dynamic president we have this time here with us. I would like to stress that he has spent a lot of work on education and training of young neurosurgeons, and I thank him for bringing neurosurgery of the lower and middle income countries into the limelight with his vision. So his topic for today is update on neurotrauma. I must add, Professor Servadei is professor in Humanitas University and Research Center in Milano, Italy. So the topic is update on neurotrauma. So over to Franco.
Hello to everybody. Hello to friends, to those one I know, to the young neurosurgeon that I don't know. Welcome everyone. We as World Federation are very happy to collaborate with Tariq and with Salman and with our Pakistan friends who have organized in these difficult times quite a lot of webinars and education, which grown up in a wide area. I see that the number of participants is going up every second, so I have to look almost 170. So it's a good, but very good participation, but it's going up. So my duty, if I can share my screen, where is it?
Imad, can you allow it? It's down at there, the green button at the bottom.
Yeah, I know, but I have to find the presentation. 1 second, okay. Because it just disappeared from the main screen. 1 second only, it's here. So I just need a second. Okay. It's just starting, okay. Okay.
Not yet.
If you see it, you tell me yes, otherwise sure. I will put it down and share the screen first, and this one. Okay, I think now you can see
yes.
Okay, so my presentation is about giving a worldwide view on trauma and on brain trauma and the short update on management. There are so many new things that I cannot tell you everything, but surgery for trauma, we know that is an important part of surgery, and it's an important part of neurosurgery. You see it here. If you look at the data that has been published by many of us, by Miguel Arraez, who is here, by Frederick Boob, Key Park, and many of us, you see that in countries, in continents like Africa or Southeast Asia, traumatic brain injury is a very important part of neurosurgery. We have studied recently and published, our group together with the group of Cambridge, we have studied in the Key Park the impact of publications versus trauma. So the question is, where are the trauma in the world and where are the publications about trauma? So you see, this is the rate of road traffic accident in the world. You see that most of the road traffic accident is Pakistan, India, Southeast Asia, like Indonesia, Africa. So in this part of the world, the road traffic accidents are very important. But this is the area of the publication, which is different from the area of trauma. So we do have a publication in one part of the world, mainly Europe and US, where trauma are located in another part of the world. And as you see it here, that the number of publications for 10 years and 2018, it doesn't really make any difference. You see that the major contributor are United States by far, United Kingdom, Australia, and then many other countries, but usually Europe and America are the main contributors for publications in trauma. And these are the countries with more than 500 papers, and these are the countries with many papers. So we do have big disparities about number of publication, you see more in blue, and number of trauma, you see it better here. In United States and Canada, the incidence is this, but the number of publication is 6 times more than the incidence of trauma. In Europe, is almost doubled. And if you go to Africa or Southeast Asia, it's the opposite. So the question is, we know a lot about brain injuries in these continents, but we know very little about brain injury in these 2 other continents, which is clear seen. Does it make a difference? So the main question is, if we are not aware of what's happening in Africa or Southeast Asia, or we know little about it, does it make a difference versus Europe or United States, or is the same? This is European data. You see it that in the last 20 years or 30 years, the mean age of patients in Europe moved from 29 years to 55. So from 88 to 2014, the mean age of our patients in Europe increased tremendously. You see that now in the recent studies, it's between 50 and 55, with over half of the patient over the age of 50. And because of this, the main cause of injury in Europe became incidental fall in elderly. It's not anymore road traffic accident, it's an incidental fall at home. And this is a typical European patient, 71 years old, fall from stairs, high Glasgow, patient under clopidogrel for a previous stroke. Obviously, clopidogrel is a very powerful risk factor, so the hematoma increased, and the patient need the surgical evacuation. But this is a typical European patient, 70 years old with comorbidities. This is the Japanese paper. In Japan, the population is old. They have found that comorbidities are more important than age in determining outcome of traumatic brain injury. So this is one part of the world. What about the other part of the world? As you see it here, road traffic injuries are getting to be, in 2030, the 5th cause of death in the world. The reason is clear. You see that it's driving without protection. So it means huge hematoma without helmets are contact injuries. These injuries we don't see anymore. So the two populations are in young population in, let's say, Africa or Southeast Asia. The main cause is road traffic accident, and we have epidural and acute subdural. In Europe or Japan or US, the population is older. We have more comorbidities, more contusion, and chronic subdural. The meaning of this is if we have a study done here, this is not replicable here. So there are two different parts of the world. And the same is true for guidelines. Since guidelines are evidence-based, they all are, almost all are for high-income countries. You see it here. These are 1, 2, 3, 4 types of guidelines, 2 Americans, 1 Canada, and 1 UK. So that's the typical guidelines from the Western. The same is true for our randomized clinical trials. This is a very good paper published by the group in Cambridge with many other collaborations. And if you look at the data here, you see that if you exclude mainland China, only 8% of randomized clinical trials were done in low middle income countries. So very few randomized clinical trials are done in these countries. So the problem is we have a lot of publication, guidelines, randomized clinical trials. Can we apply them everywhere or not? So this is the key point. And as you see it here, sorry. Okay, these are 2 randomized clinical trials in decompression. You see that in one study, 100% of patients have been enrolled in high-income countries. And in the other study, 91% of patients have been enrolled in high-income countries. The result of the second study is that if you look at the outcomes between surgery, decompression, and medical group barbiturates, you see that the difference is not significant within 6 months. The difference became significant after 6 months, after 1 year. So what does it mean? That these patients need a long care with acute phase, but also late post-acute, rehabilitation, residual deficit, social integration, quality of life treatment, treatment of complication, hydrocephalus, cranial reconstruction is a long way. How many countries can afford 1 year of treatment along this way? Maybe only, we have found that only 6 countries, maybe 7, will pay for free rehabilitation for 12 months. And 2 of these countries have included almost 90% of the patient in the rescue ICP study. What does it mean? That the rescue ICP study is not applicable everywhere in the world, which is the main update that we have now. This is a very recent paper published in Acta Neurochirurgica. Is a survey, and this is an example of how a survey can fail or can be difficult to explain. A survey, I tell the young neurosurgeon, when you read a paper with a survey, this paper tells you only the opinion of those one who are interviewed. It's not evidence-based medicine. We have to be clear, because many young neurosurgeons, when they see a survey, they think this is a standard for our management. But as you see it here, these are the reason for surgery. The green light is why do I operate a trauma? And you see that if we have high ICP, this is a very good indication, together with clinical signs of ICP, like pupillary side or responses, less guidelines, less, again, the age of the patient. So these are green lights. And you see that these surveys tell you that in Europe, we look very much at intracranial pressure. Do we follow guidelines? They survey, the center TBI investigators say, yes, we do it for subdural hematoma, epidural, and contusion. Which is the problem? The problem is that I have been one of the authors for the surgical guidelines, and as you see it here, they follow the guidelines for contusion who are not there. There are no guidelines for surgery of contusion. So you understand that when you have read here, when you have a survey, people can reply their own opinion, not the evidence. So a survey just tell you the current practice. It's not telling you what you have to do. The second part is about decompression. Is it anything new about cranial decompression? Which is difficult because we almost said everything about cranial decompression. The first thing is that you see that the number of papers published on decompression increased tremendously in about 15 years, from 94 to 200. But the most important is also the paper on cranioplasty increased a lot. You know, we had in the 90s, at the beginning of this century, 25 papers published only on cranioplasty. So it was a non-important topic. Now we have 166 papers, which means that decompression is applied mainly in trauma and infarction, brain infarction, but also in many other occasions. These are 5,000 decompressive craniectomies in Europe. You see that almost over half are done for trauma. So still the main cause of decompression in Europe is traumatic brain injury. It's like a panacea. So we try, whenever we have high intracranial pressure and basically we don't know what to do, we do decompress the patient, don't know what to do, meaning that we have tried everything, but it failed. There has been a very important trial in decompression in acute subdural hematoma, which is called Rescue ASDH, Rescue Acute Subdural Hematoma, which the question was, do we have to take out only the hematoma, or we have to take out the hematoma plus decompress the patient? So there has been a randomization between craniotomy and hemicraniectomy associated with hematoma evacuation. This is the first time in the life of randomized clinical trial in trauma that the main recruiting center is not from Europe or America. That's the first time by far. This is India, Bangalore. So the main recruiting center with more than 100 patients in this study is an Indian center. So we have shown, the group of Cambridge has shown that it is important to involve countries like India, like many others, Pakistan, Indonesia, African, North African countries, in studies, they can do it. And you know, the enrollment is over. All the 463 patients have been randomized. We're just waiting for the next step with data elaboration. But we need 1 year follow-up, so it will be needed. Then we have something new concerning limited resources countries. We know that if we do a decompression, you see a bilateral ourselves with a bilateral decompression in a child, then we need the reconstruction. This is hydroxyapatite, but you can use whatever, PEEK or titanium or the bone of the patient, anything. But you need the 2 surgeries, decompression plus reconstruction with cost. So in many countries, this is difficult. So there has been 2 tentatives to avoid decompression, getting the same result of decreasing intracranial pressure. One is the concept of hinge craniectomy. Hinge craniectomy is you take off the bone and you fix it by leaving it up in a way in which the bone is still there in 1 or 3 pieces, or you don't take off the bone, but you increase the volume by leaving the bone hang up. And there are 2 positions, 2 possibilities. One possibility is this: the whole flap is raised by 1 or 2 centimeters. So this is Brazilian publication. You split the bone flap and you fix on the 2 sides in a way in which you can increase the vault. We have written a recent review, and as you see it here, the data, if you revise the paper published, the data show that in many cases, the results were quite fascinating. The diminishing, the decrease in intracranial pressure was compared to the decrease that we obtained with decompression, but we have no randomized trial. It's only a few papers describing about 200 and something patients, not randomized in different studies. So we do need, it has been, there was a survey conducted by Cambridge where 70% of the responders all over the world indicated hinge craniectomy as a field for randomized trial. The second is the so-called cystinotomy, which is the Ipecherian was the first one to publish from Nepal, meaning there is a long discussion about the CSF redistribution, but opening the basal cistern with or without decompression will decrease the intracranial pressure. There has been quite a number of papers. Many of them are only case reports. These are 2 examples. Obviously, doing an opening of basal cisterns, you see this comment from my Italian colleagues. Opening the basal cistern is not for every resident who is in duty for trauma, and it is difficult in a patient who is swelling. So there was a paper published right now at the beginning of this year from the group in Lausanne, and you see it here that this group has studied about 40 patients, and we did publish an editorial connected to this study, and this paper showed they have randomized 40 patients, 22 with the decompressive craniectomy, 18 with the decompression plus a cystinotomy. The main problem with this paper is that the decision of doing a cystinotomy is only based on the availability of a vascular surgeon expertise, because open the cistern is not to everyone. So this is the randomization is based on that. Nevertheless, the results were promising, but as we said in the editorial, there is the same problem as we have in hinge craniectomy. We cannot say that this is a standard without showing that it works in a randomized fashion. We have to help countries with limited facilities to randomize patients. As you see it here, we still need good clinical randomized study. We understand that studying patients in countries with not limited facility, a randomized European or American standard is very difficult. Our colleagues from India say that the mortality or morbidity at discharge from the hospital may be enough to decide whether a randomized study will work or not. And this will avoid a long follow-up, which is difficult and expensive. The future is obviously working together. Tariq Khan is here, and you see that we have published many papers with people from Europe, you see it here, from India, from Pakistan, from Colombia, from Nigeria. The same here, the co-authors of the consensus conference on decompression were from many countries with limited facilities to understand how we can help each other. For instance, this is a paper that I have reviewed from Nigeria, showing that in Nigeria, the decompression is used as a preventive measure. If the patient has a very bad CT scan independently from the clinical assessment, the patient is decompressed to avoid further problems because there is difficult access to ICU, difficult access to intubation, no access to monitoring. So as you see, it is better to do it prophylactically. To finish, this is the editorial that we just published in Intensive Care Medicine, which is good in decompression. It's we have trials. It is sure that decompression will decrease mortality. About 60% of patients are independent at home in our study, in the European study. And there is sure that we can reduce barbiturates and we can reduce complication. The bad thing is some patients, many patients will survive with the range of disability. Is a question of if we can accept or not. We need another operation like cranioplasty with associated cost. We need a long rehabilitation. And obviously, as I told you before, it's limited the translation to countries who do not have this. The worst is that we cannot, at the moment, predict a degree of disability in individual patients. We don't know, simply. So whenever we operate, we must be aware of the fact that the patient can have a severe disability. We need to consider that what is a reasonable option for one patient cannot be the same for another patient. So what we don't want is like the clinician will recommend decompression on their own opinions, which is not working. We need, this is an Australian study that you see in the informed consent for the operation, many of the relatives were not informed about the possibility of a bad outcome with a very severe disability or vegetative state. So what we need to do is information, discuss with patients, intensivists, neurologists, and tell the patient that we can save their life, but maybe we will not be able to give them a very good quality of life. So it's not only a medical decision, in a clinical indication, but it's also a social decision, which is based on the preference of the patient when he was in life. So this is, whenever possible, there will be a discussion with the family about the perspective of the operation. So thank you for your attention. Unfortunately, this is Milano cleaned by the COVID, but I wish we all are better with COVID now, and I wish all your country a safe journey to normality again. Thank you.
Thank you very much, Franco. Very grateful for a very, very good talk. Some important points which I would like to just lift, and then I'll request a few people to give their suggestion, opinion. First of all, that the age distribution between the higher income countries and the lower middle income countries, the younger generation now here in the LMICs, and the type of accidents, as you know, in higher income countries now, it's more due to falls, as you said, and because being on blood thinners, a different type of patient is being seen. The other most important thing which you pointed out was that rehabilitation is the biggest problem, because you can do a decompressive craniectomy, and you know that there was a paper which showed that the 6 months period in LMICs compared to higher income countries, there was a big difference. More people were dead after 6 months in India than in the United States. So rehabilitation is a very, very important part. In the last few years, some very good work has been done, like the consensus on decompressive craniectomies in Cambridge, where we all were there. And then recently in Italy, the consensus on cranioplasty. Now we know that work is going on from Cambridge, and some of us are part of it, on hinge craniotomies as well, which I think will be a good study also. And the last most important thing which you said, and I would quote from Professor Honeybull from Australia, that if you're going to do a decompressive craniotomy, you should see whether you like it done on yourself or not. So now I request maybe Professor Dave Edelson, if are you there, Dave? Can you give a few comments? Can we unmute Dave?
Imad, can you please unmute Dave?
Yes, sir, unmuted.
Okay, thank you. Well, again, you know, the importance of understanding the differences between decompressive craniectomy in different environments, particularly for different indications. You know, when we look at differences in age and response to injury, and I think that indeed a lot of the things that Professor Servadei presented really do have some new promise, and whether it be the hinge craniectomy versus the cisternostomy, I think they're both exciting areas, and I would disagree that you need an experienced vascular neurosurgeon to be able to do the cisternostomy, but I think there is challenges to that technique, along with the hinge craniectomy. I think there are different techniques, and knowing where those would be very helpful and important for us to learn through you know, larger and more diverse studies from diverse areas.
Thank you. Thank you. I think Professor Keki Turel is online as well. If he's there, can we unmute him and ask him for comments?
Imad, please, KK.
Is it there?
Yes, KK was, we just saw him, spotted him, young. Everybody was commenting he's got a new girlfriend.
Am I audible now? Okay.
Yes,
all
you
right.
are, KK.
Yes. So, Franco, great job. We've heard some of these slides before, and I agree with you on almost every count. Yes, I have great regard for this new technique of this hinge craniotomy, but it's not new. We have practiced it long ago. what we used to do sometimes was just simply leave the wound flap very loosely on the top without applying any hinge, and keep a very loose dressing, and also leave a very large dural decompression. That's also very important. I have some experience with cystonostomy, and I agree with what Dave said, that you just need a reasonably senior resident doctor to be able to operate. The challenge is the brain is quite swollen in an acute trauma, and you will require very gentle and careful handling, which is not immediately possible by a junior resident doctor. So you do need someone with experience of handling swollen brain. Otherwise, the procedure in principle and even in practice is remarkable, and I have done it before, and I think Ayub should be given the credit for sticking to it for so many years. But of course, you have to study all aspects, and not every case will be suitable for cystonostomy, whereas almost anybody with a swollen brain will be suitable for a decompressive craniotomy. Yes.
Thank you. Thank you, Kiki. I think Professor Miguel Reyes is there. Miguel, can we mute him and request him to give his comments here?
Imad, please, can you?
Sir, I'm doing, Dr. Miguel has to accept. Yeah, he's unmuted.
Okay.
Miguel, please go on. No, he's not unmuted.
Is he not?
Okay.
Now he is. Yes, Miguel, please carry on.
Okay. Good morning, good afternoon, good evening, maybe in Pakistan. And first of all, I'd like to congratulate my very good friend Salma for outstanding webinar and outstanding course. And I think that you have done a terrific job as always, because you are a real leader in teaching and education. I very much enjoy the talk of Professor Servadei. He's a real giant, along with the other participant in the neurotrauma group. And I'm afraid I don't have any scientific level to discuss anything about what they have been saying. I think it's remarkable the issue of the differences in management, and I think everything related to global neurosurgery and the way we try, by means of education, dissemination of knowledge, protocols, and so trying to have, let's say, same access and same, let's say, quality of care, as also Dr. Tariq was stating.
Thank you very much. Thank you, Miguel.
Tariq, I do have questions via chat. I have, if I can answer, I have a question via chat.
Please.
There is one question who has been said by 1, 2, 3 people, which is in Africa and other countries, initial care on the site of accident in the emergency room is still insufficient. That's correct. But I would tell you that this was one of the main opposition to work with low and middle income countries. They told us if there is no assistant on the scene of accident, then in the hospital we will get the patient too late, they will get patient not well treated, but the need to help is already there, because our neurosurgeons in Africa or in Asia are already operating our patient in spite of difficulty in transport. So difficulty in transport is important, but it's something will not affect our decision to work together and to give them a message, a positive message of improving the hospital care of trauma. That two things are different.
Okay, yes. I think there is somebody wanting to share their views. Dr. Nuruddin? Salman, can you check this?
Dr. Andres.
Yeah, can we ask Dr. Nuruddin?
Dr. Andres is unmuted. Yes,
Okay.
please carry on. No, he was unmuted again. So can you please ask your question?
Yes, can you hear me?
Yes, we can hear you.
Yes.
Okay, thank you very much for all the professors and Cuban and neurosurgeon, a young neurosurgeon, and now I'm very glad to belong to this group. I want in first time to that all of you. My English is not very good looking. I'm Cuban, and I want to forget for any mistake. Okay, but I want to do some question about the theme that the professors say. You understand me?
Yeah.
Yes. First, I'm Cuban, but I worked in in Ecuador, like a neurosurgeon, and traumatic brain injury is very frequently in a city where I work. In this moment, I am to preparing for going to I'm going to make a cranioplasty to a patient that was operated three months ago for a traumatic brain injury. I want to make some questions. First, that I want to know if we have to do duroplasty in all the cases. And I want to say that I put the bone in the abdominal wall, and I want to know our experience, your experience with this technique.
Okay. So I'll answer. Franco, you want to answer this, please?
Well, it's easy. Duroplasty always we decompress the dura together. About the abdominal wall, we did many years ago. So maybe someone like you or have a more recent experience. We don't do it since many years.
Okay. So if you look at the paper, the consensus paper on decompressive craniotomies and then on cranioplasty, it was recommended that you can put it in the abdominal wall, but if you put it in the abdominal wall, it is better to do an early cranioplasty because of increased bone resorption in the abdominal wall. So that is the only difference between, so you need to do early cranioplasty. Another question which is being asked is that if you do a hinge craniotomy, would the edges of the bone damage the brain? I think, there has been no proper study, but from our personal experience, from my personal experience, really there has never been any damage to the brain from a hinge craniotomy. I think I'm going to ask one last person to talk, say a few words. Professor Ahmed Ali Shah, if he's around, I think I saw him from Karachi. Aga Khan, is he there? I think I saw him.
Yes, sir, he's there.
Is he there?
Yeah, Tariq, we have to wrap up and move on. So just last question and we quickly move on.
Last question. I'm looking at the watch.
Unable to unmute him, sir.
Imad, you wanted to ask a question? Imad Kanan? Just unmute Imad Kanan there.
Okay.
First, I'd like to thank you for launching this webinar. It has been very successful. I have the good feedback from my fellows, residents and colleagues. And of course, Professor Servadei, our president of the World Federation, has gave a special zest on these topics and gave it a scientific background with the studies he has shown over in the meetings and today. One thing I'd like to re-stress what Dr. Kiki Turel mentioned, there is something called the third options. We look either for the decompressive or somebody look for the cystostomy. But most of the time we combine both of them if they are feasible. So we don't stick only for the decompressive and the duroplasty. If we have access to the basal cistern, we should relieve the CSF. And this is what I call the third option. I just want to give this message. Thank you.
Thank you very much. Thank you for comments from everybody. I will now invite Professor Salman Sharif, who is the organizer of this international, very successful Pakistan Society of Neurosurgeons webinar. Salman is president of the Pakistan Society of Neurosurgeons, and he's the co-chair of Spine Committee WFNS. He's very, very actively involved with that, and he's the incoming president of the World Spinal Column Society. So Salman, please go ahead.
Thank you, Tariq. And I'm grateful to Franco for an excellent presentation. We really enjoyed that. And I think all the presentations are like that. It's this, as I said before, we started these webinars for our residents, 13 residents of ours. And slowly and gradually, I think people just wanted to do stuff, and people were free, and the residents wanted to come in. So there was a lot of involvement of various people in there. So I think what has happened over time is that really these webinars became a huge part of our life. In fact, I'd say that, the day that we do not do a webinar, I get lots of messages. Where is the link? Why is it not happening today, etc. So I think it's amazing that that's how it's happened. Imad, can you roll this, please? Can you go next? I can't do this. You're holding this. So these webinars, these are some of the people who were involved in moderating in all the sessions we did. So Mehmet Zaleli, Azam, and Hassan, both from US, Pablo from Spain, Nicolepi from Belfast, and Greg Trost again from Wisconsin. So these people started all this. Greg Trost, who's on the left on our fellow with a beard, is the gentleman who really got involved and did show cases initially. So we were calling it cases with Trost, and we had an amazing time. Next, please. Keep going, otherwise we will take a lot of time. Keep going, please. Next. So, all these people were not go that fast. Everybody in here played a huge role. Professor Rez, Miguel, and Adrian here. Don't go this quick. Some of these people gave great talks. Victor, his neuroanatomy talk. I think Asakar was brilliant. Fester, as always. Walter Jeans, Cindy was brilliant. Ramirez was excellent. So these are some of the facts that we have done. We did 38 webinars in 50 days. Sorry, go back to that, please. Can you go back to that, please? There were 46 eminent speakers. There were about 25 moderators for these, and they were from 20 countries. Average participants were between 170 to 450, and majority of the time we had people from more than 50 countries and gone up to 73 countries at one time. Can we go next, please? We started with Mehmet. Keep going, please. So Mehmet has always been, he was a star to start with, and Sandeep, they were always there for us. So everything we did, they were always involved. Next, please, keep going. I'm sorry, I don't have the control, so I can't move them. Henry with IFNE and WFNS Endoscopy Committee. We did a COVID one initially 50 days ago, and Atul did a couple of talks for us. Pablo, as always, started with clinical anatomy and has been helping my residents to do neuroanatomy webinars. Atul did a couple of talks. Nikolai Konovalov was brilliant in his talks, as always. Keep going, please. So these are some of the World Federation's Spine Committee and Endoscopy talks that we had. And all of these, and Vlad, what can I say? He's been brilliant all along. I would call him last minute, a moderator would slip away and he would come in and take his place. Amazing as always. Even gave a talk last minute when somebody slipped away. Hassan Syed has been brilliant. He's helped a lot with pediatric stuff. He's from Charlottesville, did a great job. Always Lots of good stuff. And Atul, as always, in his usual fashion, did amazing talk. I know he is in. He was brilliant all along. Keep going, please. And all the moderators from Pakistan, from abroad, did a great job. Can we keep going, please, Imad? Nicolai Piv gave this excellent talk on anatomy and how to localize lesions. As always, Francisco was there for us anytime we wanted him. He gave a brilliant talk here on thoracolumbar fractures. Danny Pevedillo gave a couple of talks, both from IFNE and directly in our webinars. Anjit Chad was there from UK. Walter Jean from US, amazing skull-based talk. And John Lee really amazed the people the way he showed endoscopic post-process surgery. Doug Orr from Cleveland Clinic, simple stuff about lumbar disc. What should we do? What should we not do? Great discussion. Sorry, I missed that. We had our spine committee meeting the same day. Salim Abdul Rauf chipped in. He's sent a message as well. Keep going, please, the other way. Keep going. Luis Barber, as always, was there for us. We have Giovanni from Italy. Keep going. And Fessler and Maurizio. Maurizio still has to give his talk next week. Adrian, Ramesh, keep going. Please keep going. Yeah, keep going. Joachim was a moderator there. Hassan Zedi from MD Anderson. And then Miguel Pablo, Brainstem. And we had Ramez and Corrales and Victor, who joined in for arteries of the brain. And as always, Pablo and Vlad, who followed that up. We had intertemporal fossa approaches, and we had a talk by Shan Raza from MD Anderson. Keep going. Sanjeeva come in, and he gave a brilliant talk, as always, on teaching the residents. Lily last week gave this talk on metastasis and IFNE WFNS endoscopy, the 5th webinar we did last week. We have another one this Saturday as well. And today we have this. And all of this, you can imagine, these 46 people that have come in, including Franco, have been brilliant. They're actually the brain of our Neurosurgical Society who have contributed in all this. And anytime I've asked somebody, everybody was available. Okay, that day, does that suit you? And if at all possible, people would come in. And we have got these webinars lined up for next 15 days as well. So, and this is all because of a lot of people who have contributed. We had women in neurosurgery, in which we had Zarina from US, Saud Bhakti, we had also Najia. So we had amazing group that came in and helped us. Anita Darbar from Pakistan was there, Noor chipped in. Residents Corner, my chief resident, along with 3 other residents, gave talks with the help of Pablo in these basic roton anatomy. So these are those residents who contributed. And they enjoyed their talk, and the participants have been amazing all along. So if you see, Pablo giving a talk, and various things that came through during this time was amazing. I think Pepe Gianali is there, who gave brilliant talk. This was Maurizio's talk, and Atul explaining about CV junction. Azam talking in OR while he was scrubbing. He was giving us a talk at the same time, finishing off. And so all this has been due to all the time that everybody contributed. So I'm grateful to everyone who's got involved. I'm grateful to WFNS, to WFNS Spine Endoscopy Anatomy Committee who contributed, IFNE who came in, and World Spinal Column Society as well. Pakistan Society of Neurosurgeons didn't do anything. We just waited and watched and enjoyed it. So I thank you all. Brilliant.
Poi torni qui? Sì. Dai il numero dell'Alessandro. Ok.
Tarek?
Okay,
yes,
so now we'll start with the, I thought you were going to do the feedback videos now. Am I right?
Okay, do you have the feedback videos ready? Imad?
Yes, I am. We have the feedback videos. I'll just put that on share.
Okay, so what we did was we asked the faculty to give a feedback videos. Out of 46, we got 25 people who sent videos. We had asked for a 20 to 25 second comments. Some of them give 5 to 7 minutes video. We had to edit it, and so it's edited video. Otherwise, we would be here till late. So let's have a look. Can we show now? I think the huge number of participants from India, Pakistan, Middle East, Indonesia, from Europe, amazing numbers that came in and joined in during this. We are actually getting some feedback data. What we have been doing is giving them forms to solve MCQs at the end. In some of the sessions we are doing MCQs before and after to see in what way we've improved or not improved. So, everybody's contributed. Can we play this, or are we going to move on with some other thing then?
Yeah, maybe shall we move on to
Are we ready, Mehak?
Sir, just putting it on.
Okay. And I'm grateful to Pakistan Society of Neurosurgeons, all the young kids who contributed. Okay, so we can start with these. Can we play? Volume? We don't have voice.
Meg, you have to click on view options on the top and share your audio.
Sorry?
You have to click on the top on view options. View options, and you can share audio, share computer audio.
Doesn't say anywhere.
No.
The view option is next to the green sign on the top.
Yeah, exactly. View options is on the top.
Click
Share
on
computer sound. Okay.
Yes, exactly. Then play it again.
Okay. Ready.
Yeah.
Hi everyone. I think I was one of the first persons to give a webinar in the PSN series of webinars. Since then, it has grown in popularity with a stellar cast of speakers from around the world. I must congratulate Salman for organizing it so magnificently. All the best.
Greetings from Madison, Wisconsin. When the COVID isolation began, PSN jumped into action to organize a series of webinars, which many have attended, hundreds, and I was quite surprised with the response until I attended the first session and realized the caliber of the presentations, the level of presentation, and the degree of organization that went into each of these webinars. I learned a fair bit myself in attending these and moderating these sessions. So congratulations to PSN and to Salman Sharif for organizing a wonderful lecture series which have benefited.
Hello friends, I would like to extend my deepest gratitude to Salman Sharif and all his team for allowing us to share our experience in endoscopic surgery. I hope this has been a great learning experience for everyone, and I hope to see you all again in the future. Thank you so much, and greetings from Costa Rica.
Congratulations to Dr. Salman Sharif and the whole organizing team for organizing this beautiful webinar educational series. It has been my honor and privilege to be a part of this, and it was a great educational initiative. Thank you very much.
Thank you for the opportunity to participate in the webinar sessions. I had an absolute amazing time interacting with everyone. I also want to congratulate Dr. Salman and his team for bridging the gap in global neurosurgical education. I'm looking forward to participating in future events. Thank you again.
Dear Salman, I want to send you the best wishes from Greifswald in Germany. I really appreciate your initiative to provide a series of webinars for neurosurgeons and neurosurgical residents all over the world. My special thanks go to you in the name of the International Federation of Neuroendoscopy for hosting our webinar series as well. I hope to see you soon. Stay well.
Thanks, Salman, for promoting education all over the globe by these webinars, as well as I would like to thank him for all the fantastic experiences that we've had when we were in Karachi doing these courses. I wish him the best.
the World Federation of Neurosurgical Society and the above-mentioned the Pakistan Society of Neurosurgery have done a great job by organizing tremendous web binaries. This has allowed to maintain our life linked to our profession and at the same time let us to share opinion and knowledge with friends.
Friends, it is my pleasure to send this message to Pakistan Society of Neurosurgeons. The webinars conducted by them is of very high standard, and particularly that includes most of the international faculties. I've been watching this for the past few months, and it is extremely good.
Salman, dear Mehmet, it has been a pleasure and an honor to participate to the fantastic activity you planned and performed during these difficult times. Thank you very much.
Hello, my dear friends and colleagues. It's Nikolai Konovalov from Moscow. Seminars what we make together during this difficult period was very important for us, for all people in the world who are interested in medicine, who are interested in neurosurgery, and I think that we continue our work in this way for future collaboration and for future happiness and wellness. Have a nice day and nice conference. Bye.
This was an outstanding project. I thank you for considering me to be part of it. And I want to congratulate Salman, all your team, and my special thanks and a big hug for Imad. Thank you.
Congratulations to the Pakistan Society of Neurosurgery leadership for the excellent webinars that were organized, which fulfilled both the missions of the society, that is the pursuit of academic excellence and bringing international collaboration, and all that without us leaving our homes. So once again, congratulations to the society. Thank you.
It was a great chance to share my experience and to meet new friends online. My great appreciation to Franco, IPNE, and Pakistan Society for organization of this program.
Send you, my dear friends, my greetings and my best wishes. We should learn our great subject very nicely and fantastically because we can give new lives to our patients.
I would like to formally congratulate Professor Salman Sharif and Galaxy of International Faculty.
I am Dr. Rajesh Kumar, Specialist Neurosurgeon and Adjunct Professor at Dubai Medical College. First of all, I am grateful and highly acknowledge the efforts taken by Dr. Salman Sharif and his team for arranging such webinars during this current COVID situation. So I am really thankful to all of you. Great efforts. Good luck.
Dear Salman, first of all, thank you very much for giving me the honor to be part of the faculty of this fantastic webinar. Congratulations for the success of this.
Dear Salman, let me congratulate you for your hugely successful webinars, educating thousands across the world.
Salman, Sharif, and the team in Karachi. I bring you greetings from Nairobi on behalf of the Continental Association of African Neurosurgical Societies. As President of CANS, I'd like to thank you immensely for the huge amount of work that you've put in on behalf of the Pakistani Neurosurgical Society.
Good morning, my dear friend and colleague, Professor Salman. It is my great pleasure to join the recognition of the International Pakistani Webinar in Education. You and your colleague establish a dent in the modern education and teaching of young generation of neurosurgeons.
Dear colleagues and friends,
no doubt that COVID-19 has revolutionized our world and our work. The series of webinars brilliantly organized by Salman Sharif among the community of International Federation of Neuroendoscopy and World Federation of Neurosurgical Societies Neuroendoscopy Committee.
It's been a pleasure and honor for me to participate in these webinars. The WFNS Spine Committee and the Pakistan Society of Neurosurgeons deserve a warm recognition for their commitment and efforts.
Hello, dear colleagues. This is Victor Hugo Perez from Mexico City. I am very grateful for the invitation to participate in these important webinars.
Dear Salman, thanks very much for asking me to provide a video following these talks. Thank you again for the invitation. I really enjoyed it. That was fantastic. I attended some of the ones I wasn't speaking at, and they were excellent. So I think a really good effort. Really enjoyed speaking. Really enjoyed attending, and keep up the good work. Okay, take care. Bye bye.
This is Hassan Zaidi at Brigham and Women's Hospital in Boston, Massachusetts. I just want to say thank you to everyone who participated in the Pakistan Society of Neurosurgeons webinar.
Hello, my name is Sean Raz, and I'm one of the neurosurgeons at the MD Anderson Cancer Center in Houston, Texas. I'd like to thank Dr. Sharif and the organizing committee for including me in their webinar series.
I would like to shortly express my immense pleasure to be part of the International Faculty of the Neurosurgical Society of Pakistan and to be involved in a wide variety of educational events presented as webinars.
Professor Sharif deserves compliments for delivering high-quality education through an excellent series of webinars over past several weeks. Together with his team of able moderators and world-leading faculty, they have covered a wide range of topics for trainees as well as experienced surgeons.
Hello, I'd like to thank the PSN Webinars team for putting together these webinars during the COVID pandemic.
My name is Dr. Uche Wambweze from Nigeria, Enugu State. I just want to let the WFNS committee know that the webinars are making a great impact on us down here in Africa.
Hi everyone. I think I was one.
So we done with the videos?
Yes, I think I think we are done here. Yes.
So we want to move forward.
Faisal, you have this COVID video as well.
Okay, can we just show the COVID video? There's a COVID video that we made for the WFNS and Pakistan Society of Neurosurgeons.
Very good.
Yes, Tarek, let's carry on.
Very nice. Thank you very much. So we'll start with the virtual distribution of the certificates, and I'll request, first of all, Professor Franco Servadei to give certificates to some of the faculty.
Before, I would say, Salman, we have many messages of people who's telling you don't stop. So I'll be asking you that even if the COVID is better, you should not stop giving webinars, which is a good idea, and I fully support it. That's the first thing. So the first one, as I understand that I have to give the certificate, is Miguel Arraiz from Malaga University and Carlos Haya Hospital, Malaga, Spain, for his great job as a lecturer in this series of webinar.
Okay, can we just okay, there was some write-up for Franco to read, which he hasn't, so it's okay. Miguel Arraiz is the, I think it was sent to you today, so you probably didn't get it. Miguel Arraiz is the president, the chairman of the WFNS Foundation, and everybody knows him, but for trainees and other people who from other part of the world, he's a great friend of education. He's been involved in various activities all over the world with us. Obviously, he's been in different posts in WFNS over time and is a huge asset of WFNS for education. And he's worked very hard for a lot of support for us in Pakistan and also in various WFNS Spine Committee and also with WFNS Endoscopy Committee in various Anatomy Committee in various meetings. So I'm grateful. He gave a brilliant talk on approaches to brainstem. So we are thankful to him. Next is Noor, you're supposed to be saying the names and I can just read this. Noor, are you there?
Next is Professor Mehmet Zaleli.
Professor Zaleli has been involved from very beginning with our webinars. He was the first one to start this, and he moderated a few of them. He was always involved in all the WFNS Spine Committee webinars that we did. He's actually an honorary member of Pakistan Society of Neurosurgeons because he's visited Pakistan more than 8 times in our Karachi spine, which is a brainchild of Mehmet Zaleli. So I'm grateful to him. Thank you. And
next we have Professor Valdemar Venice.
Vlad, as I said, has been really the backbone behind our webinars. What he's done is that anytime somebody would drop out, with 24 hours notice, we just call him and said, have you got the talk ready? And he's there for you. So he's brilliant. And he moderated quite a few of them. He's the chairman of the co-chair of the WFNS Spine Anatomy Committee. And he did help us with a lot of anatomy workshops as well. So I'm grateful, Vlad. Thanks. Next.
Next, we have Dr. Imad Kanan.
What can I say? A dear friend, a brother to me. Imad has always helped us, moderated sessions for us, and he's got a talk coming up as in near future. He's always there and always supported us in everything that we want to do. And hopefully the neuroanatomy Roton courses we want to do with the WFS Anatomy Committee so that more and more people can benefit, especially people from Africa and Asia should benefit. I think people from Europe as well, because a lot of areas where the anatomy is not taught the way it should be taught. Yes, next please.
All right, next we have Professor Chandra Shekhar Deopajani.
So Chandra has been a dear friend of Pakistan Society. He's visited Pakistan training, teaching, the WFNS Endoscopy Committee, and also IFNE. He's been a great supporter. He got involved in every Roton neuroanatomy session that we did. So 5 of them, he got involved in them. And IFNE neuroendoscopy, we have done 5 webinars, and all of them, Chandra being the chair of the WFNS Endoscopy Committee, has been involved. He's a dear friend. We talk regularly, and he's a great supporter for us in everything that we have done here. So thank you, Chandra.
Next, we have Professor Saud Bakhti.
Professor Saud Bakhti is the chairperson for the Women in Neurosurgery for WFNS. She got involved when we did a Sunday with Future of Neurosurgery for Women, and they were all amazing. We had great scientific talks as well as leadership talks from them. She's been a great supporter of us all along, so I'm grateful to her. Thank you, sir.
We have Dr. KK Terrell.
I think Professor David Adelson is supposed to be talking about these. David, have you got those that paper with you? Is David unmuted?
Yeah.
I have the list here. Thank you.
Okay, sorry. So I sorry I took over Saud Bhakti, so you go on and say say something about her again.
It's okay. I mean, Saud is a wonderful neurosurgeon and a real energetic individual who has done amazing contributions.
इस पे 2 तस्वीरें लगेंगी केके और डेविड की ताकि दोनों को पता लगे कि किसको बोलना है.
So next.
Next we have Professor Francesco Costa. Sorry. Next we have KK Terrell. Sorry.
Yeah. So well, I mean, Salman, again, congratulations for that, and also with your great relationship with KK. It's wonderful to see you again, KK, a veteran of 51 years of experience in the field of neurosurgery. The PSN thanks him brilliantly for presenting his topic on complication avoidance in neurosurgery that will always help us while performing surgeries. Written many neurosurgical and non-neurosurgical books, including complication avoidance, but conducted many international conferences on this topic in India.
Great. Next, we have Professor Francesco Costa.
Francesco Costa is working as Deputy Chair of the Oncology Section in the Department of Neurosurgery of Humanitas Clinical and Research Center. He's an active member of the WFNS Spine Committee, North American Spine Society, NAS, Eurospine, AO Spine, and Italian Neurosurgical Society. He's the consulting editor for the Spine Surgery section of the Journal of Neurosurgical Sciences, an associate reviewer of the Spine Journal and Eurospine Journal. He gave a talk which was well received on management of thoracolumbar fractures and discussed his cases with the trainees.
Next, we have Professor Luis Borba.
Professor Borba is obviously well known to many of you. He's a world-famous skull-base neurosurgeon, professor and chairman of the Department of Neurosurgery at the Federal University of Prana, Brazil. He's a prominent member of our WFNS skull-base committee and has brought immense contribution to the neurosurgical community, not only of Brazil, but throughout the world, and has really led in the areas of with his educational activities. He presented, as I understand, an excellent overview on craniopharyngiomas.
Thank you, Dr. David.
So we request turn it over to the next.
We request Miguel Reyes to carry on from here. Miguel?
Can we unmute Miguel, please?
Okay.
Yeah, hold on.
Okay, Miguel, please.
Yes, next is Dr. Sandeep Vaishya. He's a renowned neurosurgeon in India with more than 20 years experience in the field. He's an awardee of the Herbert Cross Medical and the prestigious Sand Fellowship at Mayo Clinic, USA. And he works as faculty in the neurosurgery department at All India Institute of Medical Science. He's a leading surgeon in the world of brachial plexus injuries and in South Asia for gamma knife surgery. Professor Vaishya brilliantly spoke about frontal approaches to frontal gliomas. So congratulations to Dr. Vaishya.
Next we have Professor Aib Cherian.
Well, Aib Cherian is a very good friend now for his exceptional surgical skills, and he is the director and chair of the Naval Institute of Neuroscience at Virat-Niger. His contribution toward neurosurgery is innovation in the treatment for severe head injury, among other fields. He is member of WFNS Anatomy Committee, and his topic in this webinar was techniques and tips for clipping and aneurysm in our third session of these webinars.
Next, we have Professor Maurizio Fornari.
Well, I have in my list Professor Atul Goel, could be?
Oh, I'm sorry. Yeah, sorry.
Okay, Professor Atul Goel is a very good friend, currently professor and head of the Department of Neurosurgery at King Edward Memorial Hospital in Mumbai, as well as chief neurosurgeon at Tata Memorial Hospital and Cancer Research Institute. Professor Atul's medical interests include several topics about the skull base, but is mainly known about CV junction and skull base surgery. He gave a brilliant talk on diagnosis of CVJ junction problem and also about concepts on cavernous sinus surgery.
All right, and now we have Professor Maurizio Fornari.
Okay, Professor Maurizio Fornari is a neurosurgery director in Humanitas Research Hospital. He's a recognized leader in the development of minimally invasive surgery, who among the first has adopted bloodless methods such as microsurgical decompression and unilateral approach for the treatment of lumbar stenosis instead of the much more invasive laminectomy. He, together with Professor Fessler, took a very productive session on complex surgery of the cervical spine and has another talk coming up very soon.
Now we
hi,
like Dr.
everybody.
Mehmet. Yeah.
It's my turn. Thank you again, all the organizers. I think I have to start with Professor Henry Schroeder.
Yes.
He's a very well-known skull-based surgeon from Germany, and he is also too much involved with the cranial endoscopic surgery. I appreciate his thoughts on tricks in ventricular endoscopy. The next is Giuseppe Sinali. He's from Italy. He has given a talk on endoscopic intraventricular approaches. He's a very well-known pediatric neurosurgeon from Italy. The next is Paulo Pereira. Paulo Pereira is from Portugal. He's a spinal neurosurgeon. We are collaborating too much on spine surgery with Paulo. He has done a talk on cervical spondylotic myelopathy. The next is Nikolai Peev. He's from UK. He's Bulgarian origin, a very good spinal neurosurgeon again. He has given us a talk on localization of lesion in spine surgery. Douglas Orr is from United States. He's from Cleveland and an orthopedic spine surgeon. And he has given a talk on management of lumbar disc prolapse. Thank you, Doug. The next is Jyoti Parthiban. He's from India. He's also a member of our spine committee, WFNS spine committee. He has given a talk on the management of cervical facet dislocations. Thank you, Jyoti.
Thank you, Professor Mehmet. Now I'll request Professor Chandrasekhar Deopujari to present the next three awards.
It's a pleasure to announce the name of Joachim Ortel for receiving the next certificate of appreciation. Joachim is a good friend and currently the chief chairman of University of Hamburg Saar, doing adult pediatric spine cranial endoscopy, and is a leading practitioner and has helped us in conducting several workshops. And his contribution in the webinar series on minimally invasive spine surgery was very, very appreciated.
Next, we have Dr. Sandy Lam.
It's my pleasure to introduce Sandy Lam. I have met her only earlier this year, but she's joined as chair, I think, at the Lurie Children's Hospital in Chicago. And she's had excellent lecture on ventricular endoscopy, especially with fiberscope. And she's also going to be part of the Future of Neurosurgery series, which is happening during this webinar. Thank you, Sandy.
Next, we have Dr. Adrian Chacon. Sorry.
Adrian is another friend from Costa Rica. He's had his training at Harvard, and he's currently the senior neurosurgeon at the National Hospital in Costa Rica. And his contribution on how to avoid complications in third ventriculostomy was really very well appreciated. Thanks, Adrian, for your contribution.
Next, we have Professor Gregory Trost.
Professor Gregory Trost, I'm not personally very familiar with, but Salman tells me is a very great friend of the spine committee. And though I have not had an occasion to listen to his lecture, his case series with Gregory Trost has been also very popular during this PSN webinar series. And I am very happy and thankful to him for joining this webinars.
Thank you, Dr. Chandrasekhar.
He is from University of Wisconsin, USA. I forgot to mention that.
Okay, just to say that we are going to have a group photograph at the end of all the faculty, so please stay back if possible.
Next, I'd request Professor Maurizio Ferranari to present the next few certificates.
Okay. Can I speak?
Yes. So,
do you hear me?
Yes, we can.
Okay, so I want to introduce, first of all, Professor Pablo Gonzalez. He's the so-called rising star in the world of neurosurgery. He's working in Valencia, and he's well known for his anatomical study, outstanding 3D anatomical studies, and he's a member of the World Federation of Neurological Surgery. And he's also one of the founders of the International PSN Anatomy modules. He gave this speech about clinical anatomy of skull-based lesion and of the brainstem as well, and of the phylogenetic evolution of the brain. He's one really of the rising figure in our world of the World Federation. And I think we can move to the next colleague.
Next, we have Dr. Ramesh Nair.
Dr. Ramesh is working since about 10 years in Charing Cross Hospital. He's well known for his spine work and also for his neurovascular disorder concern. On this occasion, he gave a beautiful presentation about surgical principles of meningioma excision, and I hope he will join us again in the meeting that Salman will for sure organize afterwards. And then we move to a very famous guy who is Salem Abdul Rauf. He's mostly known for his work in the vascular field. He's author of plenty of publication and of the work of the book Cerebral Revascularization. He is very, very active in the world of neurosurgery. In this occasion, he gave a contribution which was really appreciated about the anatomy of the skull base. It was a clear and precise study that he gave in his presentation. Then I think the last colleague that I have the pleasure and the honor to present, Hassan Syed. He has been trained in Anne and Robert Glory Children's Hospital. And he's very well known because he co-founded the Global Brain Surgery Initiative to improve the quality of neurosurgery worldwide. He has been dedicated to education, to the improving of the teaching and let's say any updating of the young guys all over the world. He gave a contribution in the international PSN rotor neuroanatomy modules, and he also gave a talk in this occasion in the evaluation of pediatric patients in neurosurgery, and also in about the subject craniosynostosis, about when and how to treat these difficult cases. So I think that I finished the presentation of my colleagues, and I thank you, Professor Salma, for this opportunity.
Thank you, Dr. Mauricio. Now I request Professor Imad Kanan, who's the co-chair of the WFNS Neuroanatomy Committee, to present the next few certificates.
Well, it's my distinct pleasure to present Professor Giovanni Grazio. He's professor at the University of Palermo with a major contribution in skull base and oncology, as well as spine and vascular transformation and neurovascular surgery, with a wealth of publications. And he contributed to the webinar on hybrid surgery. Okay. Next will be Richard Asaker, a close friend, professor of neurosurgery at the Regional University of Lille in France. He has an immense contribution in the field of spine and specifically in minimally invasive spine surgery, with a wealth of presentation and contribution to international venues. He has contributed to the international Pakistani webinar on the management of thoracic disc. Move to the next is Professor Victor Perez. Victor Hugo Perez, don't mix him with the author, okay? He is the 21st century anatomist, a neurosurgeon from Mexico with a major contribution on the field of neuroanatomy. He is our backbone in the neuroanatomy committee. He has discussed the arteries of brain on the webinar. The last one will be Professor Walter Jean. He is a professor at the George Washington University Hospital with major contribution in the field of hybrid use, endoscopy, and open skull-based surgery, with a contribution to the international webinar on the art of approaching skull-based surgery. I conclude and thank you.
Thank you, Professor Imad Kanan. Now I'll request Professor Mahmoud Qureshi, who is the co-chair of the WFNS Endoscopic Committee, to present the next few certificates.
Thank you very much, Salman and the team, and allowing me the opportunity to introduce and present the names of excellent faculty. Amongst the galaxy of star faculty, we have Danny Prevedello, who's a world-renowned skull-base endoscopic surgeon, originally from Brazil, but worked with Amin Qasim in Pittsburgh. He's associate professor and director of the minimally invasive cranial surgery program of the neurosurgical department in Ohio State University. He is known for the brilliant surgical skills that he possesses, and he gave a superb concept talk on endoscopic anterior fossa meningioma excision and on intraventricular tumor management. Danny Prevedello. The next faculty that I'm privileged to honor is Ramiz Kyrolos. He is a Silver Scalpel Award recipient by was received by Professor Ramiz Kyrolos, along with the Hallett Prize from the prestigious Royal College of Surgeons of England. He's a senior neurosurgeon at NNI in Singapore General Hospital. Dr. Kyrolos has over 75 publications, 100 presentations, 30 invited lectureships, and written many chapters in a book and is the co-author of the Oxford Textbook of Neurosurgery. His clinical interests include the arteriovenous malformation, intracranial aneurysms, and skull-base surgery. He gave a wonderful talk on arteriovenous malformations in one of the PSN webinars. The next faculty to be honored is Luigi M. Carvalho. Luigi is a neurosurgeon at the Department of Neurological Sciences at the University of Napoli, Federico II, in Naples, Italy. He is well known for developing and modernizing the skull-base surgery with the Naples group. He had an amazing contribution in the IFNE WFNS endoscopy craniopharyngioma weekend by his talks on endoscopic endonasal approaches. Next is a close associate, a friend and colleague with whom I've had the privilege of working. It's Anila Darbal. Anila has worked as the assistant professor of neurosurgery at St. Louis University Hospital in Missouri. She's currently the medical director at Mukhtar A. Sheikh Hospital and consultant neurosurgeon. She's also a prominent member of WFNS Women in Neurosurgery, an eminent faculty of WFNS Women in Neurosurgery, and was an important part of the Sunday with Future Neurosurgery and gave an amazing talk on the tips and tricks in colloid cyst resection. The final faculty that I'm honored to acknowledge is Michael, on my list is Michael Steinmetz, and he is chairman of the Department of Neurosurgery at Cleveland Clinic. Do we have Mike?
It's virtually
no.
already.
Has contributed to numerous books, if I may continue to highlight, and the most recent being Benzel's Textbook of Spine Surgery. He serves as the Vice President of the Congress of Neurological Surgeons, is Secretary to the Council of State Neurological Societies, and Executive Committee.
All right. Now, thank you, Dr. Mahmoud Qureshi. Now I request Professor Valdemir Beniz, who's the chairperson of the WFNS Neuroanatomy Committee, to present the next few certificates.
Yeah. Oh. Hello, everyone. First, let me thank Salman and his team for letting me be part of this great endeavor, and I must say that I have enjoyed myself very much. So let's start with the certifications. First is Dr. Azam Ahmed, who specializes in surgery for complex skull-based tumors, like pituitary adenomas, cerebrovascular disorders, and neuroendovascular surgery. His main goal of research contributions was to streamline stroke care and assist with clinical decision-making while developing a user-friendly interface. Azam has been very kind and supportive, moderated for seminars in numerous sessions, and has been an integral part of international PSN rotor neuroanatomy modules. So our gratitude goes to Dr. Ahmad for immense support to international PSN webinars.
Next, we have Professor Zarina Ali.
Yeah. Professor Zarina Ali is an assistant professor of neurosurgery at Pennsylvania Hospital. She completed both her residency in neurological surgery and also fellowship in nerve surgery at the Hospital of the University of Pennsylvania. Her expertise involves treatment of spinal stenosis, brain tumors, carpal tunnel syndrome, brachial plexus injuries, and any other neurosurgical condition. She is the founder and director of Penn Neurosurgery Enhanced Recovery After Surgery program. And the team would like to thank her for the session Sunday with Future of Neurosurgery.
Next, we have Dr. Abida Shah.
Well, it's a great pleasure for me to announce my good friend, Dr. Abida Shah, who is a distinguished assistant professor in neurosurgery at SET GS Medical College at the KEM Hospital in Mumbai. She holds high levels of expertise in skull-base surgery, vascular neurosurgery, both open and endo, and craniovertebral junction disorders, which is not surprising. Dr. Shah can be credited with a high volume of publications in peer-reviewed and indexed national and international journals. An associate editor with Journal of Craniovertebral Junction and Spine. And as concerning the seminars, we would like to thank her for teaching the anatomy of Pepes circuit and limbic system for fiber dissection.
Next, we have Dr. Maya Babu.
Okay, he's a neurosurgeon from Cleveland Clinic, Martin Health in Port St. Lucie, Florida. He attended Harvard Medical School and received an MD cum laude in 2010. She also attended Harvard Business School, where she received her MBA also in 2010. Her clinical interests include treating patients with traumatic brain and spine injuries, post-traumatic pain, neurosurgical pain disorders, brain tumors, degenerative spine disorders, spinal tumors, and also spinal cord stimulation later implantation. She joined the seminars for Sunday's Future of Neurosurgery, and she talked about neurosurgical pain management.
Next, we have Professor Richard Fessler.
Yeah, very good. He's a professor of Department of Neurosurgery in Rush Medical College. He's dedicated to finding innovative methods to repair spinal cord injuries, and he has been a pioneer in minimally invasive spine surgery. He has made significant contributions to endoscopic and microendoscopic surgical developments, special interests in spinal cord transplantation research, and he was the first physician in the United States to perform human embryonic spinal cord transplantation. He's a member of WFNS Spine Committee. He enlightened the very important technique of complex surgery of the cervical spine, deformity in the cervical spine, anterior, posterior combined approaches in PSN webinars.
Thank you, Professor Valdemir. Unfortunately, we don't have Professor Saud Bakhti with us today to present the next few awards.
I will do that, no problem.
All right, thank you. Yes. So first, we have Professor Najia Al-Abadi.
Where is the, can we move on? Next, please.
Next,
can we move from Richard Fessler to next? Wake up. Yes, thank you. Najia is a dear friend for many years. She's been involved with everybody from everywhere. She's actually at the moment, I think she's assistant treasurer at the moment of the World Federation, so involved in the executive committee. She has been the founder president of the Moroccan Society. And she has always helped every educational event that we have got involved. She was always there for women in neurosurgery and gave an excellent talk, learning to be a mentor.
Next, we have Dr. Hassan Zaidi.
Hassan Zaidi is actually the associate professor of neurosurgery, and he's the co-director of the Adult Deformity Scoliosis Center at Harvard Medical School, Brigham and Women's Hospital, in the Dana-Farber Cancer Institute in Boston. He is involved in deformity surgery and gave an excellent overview on adult scoliosis surgery and what's new in it and what are the things that new guys who want to go into deformity should get involved with. It was a brilliant talk.
We have Professor Oner Yaman.
Oner is a dear friend for many years because of our involvement in spine. He was involved with us in Middle Eastern Spine Society, in the World Spinal Column Society, and now in the WFNS Spine Committee as well. And he gave, can we go back to Oner? Hassan Zaidi, we have already done. Yeah, thank you. And he gave an excellent talk on surgical balance. He is one of the upcoming stars in the deformity surgery in Istanbul.
Thank you, Dr. Saman. Next, I'll request Professor Nakibullah Chaksay if he's present. He's the Senior Vice President of the Pakistan Society of Neurosurgery.
Hello, everyone. Can you hear me?
Yes, we can.
Let me first take this opportunity to appreciate the efforts of Salman for arranging a wonderful series of webinars with international collaboration. And he has transformed the challenge of COVID-19 into opportunities. And let me first introduce the faculty speaker, Nikolai Konovalov. Nikolai Konovalov is a proud son of world-famous neurosurgeon Alexander Konovalov from Burdenko Institute of Neurosurgery. He is professor and chairman of the neurosurgery department at Burdenko Neurosurgical Center in Moscow, Russia. He gave an excellent presentation on modern aspects of minimally invasive spinal surgery, intraoperative CT, and navigation. He is an active member of World Federation of Neurosurgical Society's Spine Committee. And let me, it will be my pleasure to introduce the next speaker, John Lee. John Lee is Associate Professor of Neurosurgery at the Pennsylvania Hospital and well known for minimally invasive skull-based surgery all over the world. He is involved in education and training worldwide. He has published extensively on tumor surgery. He delivered a talk on endoscopic post-fossa surgery. And it is my pleasure to introduce the third speaker from my list, Mr. Sergey Gorlishev. Sergey is serving as chief at the Department of Pediatric Neurosurgery of Burdenko Neurosurgery Institute, Moscow. He has contributed to our community with his expertise in pediatric neurosurgery and has many research publications to his credit. He gave his expert talk on endoscopic assisted transcranial approach, and he is involved heavily with International Federation of Neuroendoscopy. Thank you.
Thank you, Professor Nakibullah Chaksai. Next, I'll request Professor Asif Bashir to present the next few awards. He's a Vice President of the Pakistan Society of Neurosurgery.
I think Dr. Asif Bashir is not here.
Okay. Dr. Salman.
I can do this, no worries. Sanjeeva, this is, can you go to the next, please? Next, we have already done Sergey. Mehak, can we go next, please? Yeah, Sanjeeva is a dear friend from Oxford. He's part of their skull-based team. He's the head of director of the skull-based team at Oxford. A brilliant neurosurgeon, a dear friend. And I requested him to give a talk on how to do a good pterional craniotomy without giving complications. And he gave an amazing talk. So we are grateful to him. Everybody loved it. Shan Raza is from the MD Anderson Hospital, and he's the director of the skull-based surgery. And he's done some amazing work there. His main interest has been in the research in all the cancers of the infratemporal fossa and the outcome related to it. And he, along with Sanjeeva, gave excellent talks on infratemporal fossa surgery. Next.
Next, we have Professor Liliana Angelov.
Okay, Lily and ourselves have been associated for many years because of her involvement in the World Spinal Column Society. And she's the neuro-oncology chief at Cleveland Clinic. And she gave an excellent overview of management of brain metastasis in our last webinar, and showed brilliant cases to design and plan treatment.
Next, we have Professor Amjad Shah.
Amjad is a dear friend for years and years, and we have done Coventry Spine Masters along with, can we go back to Amjad? Yes, thank you. Just stay there, please. So he has been an amazing friend of Pakistan. He's helped us with loads of conferences, workshops all over the world. His contribution in neuroanatomy has been amazing. Even in all the webinars, he has also helped Pakistani exam, in which he's helped in various ways as an external examiner and a guidance for how we should improve the exam here for our residents.
And I would request, is Dr. Franco Servadei still here?
He should be there, don't worry.
Yeah. Yeah, so I would like to request him to present a certificate to Professor Salman Sharif.
Okay.
Yeah. Well, what can I say? The only thing I can say is that your attendees don't want you to stop. And it is the biggest congratulation you can receive. You have distributed science and education in a difficult time for all of us. And you have been very appreciated all over the world. I see many countries. You are perfectly fitting with your role in the World Federation, which is promoting education in countries in need. And I am really very happy to be with you today and to deliver to you our best congratulations for your courses. And please don't stop. That's the only thing we can ask you, not only the participant, but also what we are saying, we ask you officially on behalf of the WFNS. Please continue.
Okay, fair enough.
Your certificate.
Thank you. Thank you very much.
I'll request Professor Salman to present the certificate to Professor Franco Servadei.
And I think likewise, what has happened is that over the years, since you've become the president, you've always supported us like unparalleled support. What we have done over time to do that meeting in Peshawar with Tariq and hopefully upcoming meetings here, I think it all depends on how COVID responds. So, but you have your support to the Spine Committee and to Pakistan Society of Neurosurgeons has been unprecedented. So we are grateful to that. And this certificate is really appreciation for you for giving a talk in this, and on top of it, teaching the residents and also supporting all the faculty that has done so much for us. So I'm grateful. Thank you.
Thank you.
Okay.
To
Professor
Dr.
Tariq Khan.
Yes.
I think Franco should say a few words. I don't have to say anything.
Well, Tariq is a friend, a long-lasting friend. We were together in the Neurotrauma Committee of the World Federation. When I became president, I changed a bit the way in which nominations were done for committee chairs, and I think we should encourage neurosurgeons from different countries to take that role, not only from some few countries. And I think Tariq is at his second mandate in neurotrauma, and we all are very happy with this tremendous work in trauma, in promoting also prevention, which is extremely important in this field. And I'm very happy to deliver this certificate to my friend Tariq.
All right.
Okay, before the vote of thanks, we're going to have a group photograph. So can we all open our videos? And
Meg will have to stop sharing the certificate.
Meg, can you please stop sharing this? Tariq Khan has got his certificate. Thank you. Can we all open our videos, please? So that we can get group photograph. Ahmad, are you there to take pictures?
Yes, sir. Yes, sir.
Can you switch on yours as well? It's okay. You can come in.
Yeah, it's on.
No, I don't see your video.
Wait.
Yeah.
Fair enough. So everybody smile. Everybody smile. Come on. 1, 2, 3, go. Smile, everyone. Okay. Ahmad, have you taken this?
Wait for a few seconds because I have to capture all the pages.
Konovalov, you have to show us the victory sign. Brilliant. Go on to the next one.
Yeah.
And next. So we are done. Our group is done. The other group, they have to do.
I have taken 3 pages only.
Okay, brilliant. That's brilliant. So Tariq Khan, you need to come in to say a vote of thanks here.
So on closing this excellent webinar, very innovative way to do it, as Atul just said as well in his chat. I would like to take this opportunity to thank Professor Salman Sharif and his whole team, his IT people, his medical officers, his trainees, who have done a tremendous job in organizing these webinar sessions. And as we have agreed that you are going to continue, rather it's a directive from the president of WFNS, we will continue these webinars for the future. I also would like to have special thanks to all the faculty who have taken time out in these difficult times to be able to come in and teach the young neurosurgeons and everybody. And very heartening to see the large number of young neurosurgeons really who have come and joined in these webinars, and the feedback which we keep on getting is that they're very appreciative and they have learned a lot from these sessions. I think never ever has this sort of thing happened where so many people are coming and joining and learning from experience of many great people, many great neurosurgeons. And finally, my thanks to the WFNS, to President Franco Servadei, all his committees for supporting these webinars. Thank you all for joining us here. I think we are going to close in time.
Thank you, Tariq. I think that I'm just going to say we just need to share the link for the forms so that residents who have come in, they can fill their forms and they get their certificates. It's important that we please share the link. So people who want to leave can leave. We are closing here, but the forms are going to be shown now so that everybody can contribute. So there's a feedback. On top of it, there is a form that we send to them. So can we just share the form, please, quickly, Imad? Are we there?
Yeah, it was shared.
Okay, brilliant. So the form is out there. So please give your feedback. We don't have multiple choice questions today. So today is a vacation for multiple choice question because the president of the WFNS is here. So we don't ask you any questions today. Or Franco, if you want to ask a question, you can.
No, it's okay. I'm happy with this.
So no feedback for today.
Good.
No, brilliant. So I'm grateful to everybody and bye-bye. So we get another picture with bye-bye. Okay, guys.
Bye.
Okay, bye-bye. Thank you.